Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. AR management. So AR is nothing but, as we know, aortic regurgitation. So now let's look at the stages. So first is stage A. A means at risk. A means at risk. So what are the valve abnormalities? So the valve abnormalities. So what does the valve abnormalities include? So this includes, there is BAV. BAV stands for the bicuspid aortic valve. So it is nothing but the BAV. Next is, there is valve sclerosis. Then comes the disease of aortic sinus. The disease of the aortic sinus as well as the ascending aorta. Then is the rheumatic fever history as well as the RST. Then comes the IE. So this IE stands for the infective endocarditis. So now let's look at the changes. The changes in terms of the stage A. So the changes, it includes that it is not seen and it may be absent or the trace aortic regurgitation. Next we look at the type B. Here type B means it is progressive. So it is progressive AR. And what are the valve abnormalities here? So when you look at the valve abnormalities, so what does it include? Valve abnormalities, it includes the BAV. BAV, as we know, bicuspid aortic valve. Then it also includes the valve calcification. So there's valve calcification as well as it is mild and moderate. Then comes the dilated aortic sinus. So there's dilated aortic sinus, there's rheumatic heart valve, as well as the IE, that is the infective endocarditis. Now let's look at the hemodynamical changes. So hemodynamical changes, it includes, there's a left ventricular LV systolic function is normal. Left ventricular systolic function, it becomes normal. Then when you look at the LV dilation, it becomes absent or it can be present or mild. Then we move on to the type 3. So what's happening in type 3? So here in type 3, it is asymptomatic severe AR. So it's asymptomatic and the presence of the severe AR. So under this, what are the valve abnormalities? So bicuspid aortic valve, then calcified valve disease. Next, what is the presence? Next, there is calcified valve disease. We have seen calcified valve disease. Then diffused. There's dilated aortic sinus as well as the ascending aorta. Then comes the RV, rheumatic valve changes, RVC. Then the IE, infective endocarditis with the abnormal leaflet closure. Or the perforation. So here, what are the hemodynamical changes? So in terms of type C, what are the hemodynamical changes? Hemodynamical changes, it includes that in terms of the stage C1. So stage C1 LVEF. So stage C1 LVEF, it is normal. So by this, it is greater than 55%, that is left ventricular dilation, and it is mild as well as it is moderate. Next we move on to the stage 2. So stage 2, we have LVEF, and this is also decreased, that is less than 55%, and it is left dilation as well as it is severe. Lastly, we move on to the type D. So here in type D, it means it is symptomatic, severe AR. So type D is very severe, so it is severe AR, and the causes, the abnormalities are BAV, that is the bicuspid aortic valve. Then comes a calcified valve disease. So this is the calcified valve disease. Then the dilated aortic sinus or the ascending aorta. Then comes the rheumatic valve changes and the infectoendocarditis with the abnormal leaflet closure. So infectoendocarditis with the abnormal leaflet closure. So it has leaflet closure as well as there is presence of the perforation. Now, what are the hemodynamical changes associated with this type? So when you look at the hemodynamical changes, it includes the LVEF. So there's LVEF and it may be normal. Normal means it is greater than 55%, and then comes mild. Then is mild. So mild means about 40 to 55%. Then comes severe. Severe means it is about less than 40%. Next is the left dilation is about moderate to severe. So left ventricular dilation, it becomes about moderate to the severe form. Now let's move on to the managing this AR. So how to manage this AR? So the first will be to check if it is symptomatic or asymptomatic. So let's move on to the pathway of asymptomatic. So if it is asymptomatic, the next will be to look for the left LV function. So once the LV function is done, there are two possibilities. That is, it is normal. So in terms of left ventricular function, it becomes normal. It means continue monitoring with the clinical follow-up. So you continue the monitoring as well as you do a clinical follow-up. You follow up as well as you do a echocardiography. So next is the next pathway will be when the left ventricular function, it's asymptomatic and the left ventricular function, it is progressive. There is presence of progressive deterioration. So here in progressive deterioration of the left ventricular function. So here what is seen? So here the surgery, if you see, it is indicated. The surgery is indicated. And the other part is when you get back to the chronic aortic regurgitation. So it was divided into asymptomatic as well as symptomatic. So when it comes to symptomatic, you directly move on to the surgical aspect. That is, the surgery is indicated. Now, moving on to the pathway of the surgery indicated. So when the surgery is indicated, there are possibility of the rheumatic heart disease. So rheumatic heart disease or the valvular AR. So we are calling it as the VAR. So rheumatic heart disease or the valvular AR. Then comes the IE or the presence of the trauma. And lastly, there is the aneurysmal dilation of the root. So there is aneurysmal dilation. So aneurysmal dilation is of the root and the proximal descending aorta as well as the proximal descending aorta. So there's RSD VAR, there's infectoendocarditis or trauma. The third category is the aneurysmal dilation of the root or the proximal descending aorta. So here under the RSD or the VAR, there is the aortic valve replacement, AVR. So R stands for the replacement. Next is the IE or the trauma. So what is the IE or the trauma? It is the primary surgical repair. So primary surgical repair. Now there is a last variety. There is the aneurysmal dilation of the root and the proximal descending aorta. So under this there is a narrowing of the annulus. So narrow of the annulus. Next will be the excision of the portion of the aortic root. So excise the portion of the AR aortic root and the aortic root reconstruction without the valve replacement. So the aortic root reconstruction. So there's reconstruction without the valve replacement. So without the valve replacement, the aortic reconstruction is done. To learn and grow daily like this, please do subscribe.